My name is Gabrielle Wilton, and I will be doing my formative speech tour on James Rachel's active and passive euthanasia. To start, there are 3 types of euthanasia: passive, physician-assisted suicide, and active. Passive is going to be something as like a DNR, do not resuscitate, or stopping treatment to let the patient die on their own. Physician-assisted suicide is not legal in all states. However, in the states they are, you would go to the physician, they would give you the means to end your life, and you would go home and do it yourself. Active, which is not legal, and the big argument of this debate is basically a lethal injection to kill a patient after being told they wish to die. The importance of this is the medical ethics, where doctors can, go cross that line, not what's medically ethical to do to a human. Rachel is trying to get the attention of medical professionals such as doctors and trying to change their mind from being against active to proactive. The question also arises if this is a positive or negative right: the right to not have interference, the right to die, so that would be the negative right, the patient has the right to die, whereas a positive right, maybe the doctor wants to opt out of these because they don't feel comfortable doing active suicide, so that would be their right to opt out. Rachel's stance is obviously for active suicide, euthanasia. He's saying that line that the government has set needs to be erased. He gives the example of a patient with incurable cancer. He has a few days to live. He is in agonizing pain, and he just wants this all to end. He wants the pain and suffering to go away, and his family agrees. So they go to the doctor, and they ask for end of life. So he then says passive. The doctor would, have him sign a do not resuscitate, and the doctor would let the patient die, not call a code on him, or, stop treatment. Or you have active, he would walk into the room, put a lethal injection to the IV, and the guy would die quick and painless. He also brings up the issue with infants, basically stating that not performing a surgery will have a infant die. This is passive euthanasia technically, but that people see that as inhumane because they're saying you have to have the procedure on the infant, but basically the same as what you're doing is passive euthanasia to a child. So he's going to talk about, in his chunk of his article, about active suicide and the reasons to be for it. His main reasons are humanity, irrelevant grounds, and killing versus let die. Humanity, he says that if you erase that line that the government has set, that, if you cross the line, you're an active euthanasia, which is murder, because you acted on the patient and you killed them. He says this is inhumane. You need to erase that line, and if that line was erased, you would simply see that letting the person suffer for days, hours, days, weeks, months, and they're in miserable pain, they just want to die, is more inhumane than just walking in, giving a painless and quick injection into the IV and granting the patient their wishes. He's saying that other patients use irrelevant grounds to justify passive euthanasia, such as a patient, a parent who gives birth to a child with Down syndrome, who also has a bowel obstruction, and if they don't have surgery, the child will die of the bowel obstruction. But the doctors and parents believe that since the child has Down syndrome, it is best to let the child not live because the life would not be good. So they say, we're not having the surgery. So it looks as though the reasoning to death is the bowel obstruction, whereas they really passively did not do anything to help the child live. And that's not relevant grounds. It should be based on the pros and cons of the bowel obstruction surgery, ignoring the fact that the child has Down syndrome. He then talks about killing versus letting die, how everyone sees that it's different, but in reality, it's not. You can pass that line because he gives the example of Smith and Jones, who are bound to inherit money, family inheritance, a lot of it, so they're going to gain something if something happened to this 6-year-old nephew, I believe, this child. Both same situation. However, Smith plans out, I want to kill, I want the motives of the inheritance, and he goes into the bathroom while the kid is taking a bath and just drowns the kid. So he actively does something. Whereas Jones plans the same thing in his head, his same motives of the inheritance, wants the kid out of the picture so he can get the inheritance, but by chance walks in, the kid hits his head, falls, and drowns on himself. But Jones simply just stands there and watches and does nothing to help. Basically, when looked at morally, we're saying that that's not okay. Both had the intent to kill, the motives of gaining something good, but one didn't physically push the child under, one just kind of let it happen. But he still literally watched a child die. So they're saying morally, these are both wrong. Some objections to this would say, well, that's different. They both had moral gain, like they both had gains in their immoral acts, whereas doctors would not. They have nothing to gain from killing their patient. Another objection from Foote, from another article, I believe the next article in the book, he's saying you cannot cross that line because actively killing someone is murder. Whereas passive is omission. You are not doing anything and just letting the patient die. Rachel's argument back to this is basically saying, yes, the doctor actually is doing something. He's doing letting the person die. That's the act he's doing. He's letting the patient die and not doing anything about it. So omission is not a valid, he's saying it's not a valid excuse. But what he's saying is active, when you put the lethal injection in and you kill the patient, his Foote is saying that is wrong. That's an action, and that is looked at as murder because you are bringing upon, through your actions, death onto the patient, whereas passive, you're not bringing, the illness is bringing upon the death on the patient. So all in all, Rachel's is really pushing to change people's minds to active because he believes it's more humane. There is no moral difference between letting someone die and killing because the motives are the same, to end the miserable pain of the patient, and they want to be dead anyways. So that's what he's saying. The line needs to be erased and it should be allowed because it's more humane. It's a quicker and less painful way instead of letting the patient just suffer and die through passive euthanasia.